So STDs are fairly prevalent in a young sexually active population. It does vary in men and women, but in general, we screen for HPV, gonorrhea, chlamydia, syphilis, herpes. There are blood tests also that screen out for HIV, hepatitis A, B, and C, um, as well as syphilis. And these are all important because they are rampant in our society and they are on the rise in some populations. So typically within 24 hours, many of those results are available and we will contact you. Otherwise, it takes anywhere from 2 to 3 days for the rest of the results to come through. So we've done this thousands and thousands of times. We see a young population as well as a middle-aged population. And in the era of Viagra, where there's not that concern anymore with performance in many individuals, and unfortunately, older individuals who are no longer capable of producing offspring think that they don't have to have safe sex anymore. So they too are at risk for STD. So we do a lot of screening in all age groups. So there's not one pill fixes all. Each one does have medications that are very active in correcting that problem. Syphilis, we use a shot called bicillin. It's a penicillin derivative. If you're penicillin allergic, we would use Rocephin or sometimes doxycycline. For gonorrhea, there's a lot of resistance out there. There's really only one good therapy. It's called Rocephin. It's an injectable medication. Sometimes we'll use high-dose Cipro or high-dose azithromycin. They can sometimes be effective. And for the others, there's a variety of generic medications that really very easily manage all of those other conditions. For HPV, which is the most common STD out there, obviously screening is done with pap smears both vaginally and anally. And if it's identified, then there's further management that is required, typically with either freezing or electrocautery, or sometimes surgical intervention is needed to eradicate that. So for most of these treatments, there are very few side effects. Doxycycline sometimes causes GI side effects, but in general, they're well tolerated, easy to take, very effective in eradicating the condition that it's being used for, and with very few drug-drug interactions if you're on polypharmacy. So patient-physician relationship is really the key to any good relationship. I think it's critical to have a trusting rapport with your provider. You need to be able to communicate with him or her. You need to trust that they'll keep your confidence. You need to also believe what they tell you. And so with that, I think you can't have any effective healthcare relationship if you don't have a good primary care provider that you can rely upon and confide in.